Have you ever wondered how chronic pain can affect your daily life? It's like an uninvited guest that overstays its welcome, causing not only physical discomfort but a host of other effects. Imagine a constant throbbing that shadows your every move, a persistent ache that dims your focus, turning simple tasks into Herculean challenges. But it doesn't stop at just physical discomfort. Chronic pain has a crafty way of weaving itself into the fabric of your mental well-being, bringing along stress, fatigue, and even anxiety. It's like a pesky background noise that disrupts your daily activities, making it harder to concentrate, to work, to enjoy the things you love. It can put a strain on your social interactions and professional life, making you feel isolated in your own world of discomfort. Chronic pain can transform your life, but there are ways to manage it effectively. Before we delve into strategies for managing chronic pain, we must first understand what we're dealing with. Chronic pain, as the name suggests, is persistent. It's a type of pain that doesn't just go away after a few hours or even a few days. It sticks around, often for months or even years. It's different from acute pain, which is a normal sensation triggered in the nervous system to alert you to possible injury. Chronic pain can stem from an initial injury, such as a back sprain, or there may be an ongoing cause like illness. Common causes include arthritis, a condition that causes inflammation and pain in the joints, and fibromyalgia, a disorder characterized by widespread musculoskeletal pain. Back injury, nerve damage, and migraines are also frequent culprits. Chronic pain can be a complex and multifaceted issue, but understanding it is the first step to managing it. Now, let's explore some non-medical strategies for managing chronic pain. When we think about pain management, we often think about medications and medical treatments. However, there are numerous non-medical strategies that can also be incredibly effective. These strategies not only help manage pain, but also contribute to overall wellness and quality of life. Let's start with regular physical activity. Now, this may sound counterintuitive, especially when you're in pain, but maintaining a moderate level of physical activity can actually help reduce chronic pain. This doesn't mean you need to run a marathon or lift heavy weights. Simple activities like walking, gentle yoga, or swimming can make a significant difference. Next, let's talk about mindfulness and relaxation techniques. Mindfulness involves paying attention to the present moment without judgment. This can help you manage pain by changing your relationship with it. Techniques such as deep breathing, progressive muscle relaxation, and guided imagery can also help reduce the intensity of pain and promote relaxation. A healthy diet is another crucial part of pain management. Certain foods can increase inflammation in the body, which can exacerbate pain. On the other hand, a diet rich in fruits, vegetables, lean proteins, and whole grains can help reduce inflammation and improve overall health. Adequate sleep is also essential. Chronic pain can often interfere with sleep, but there are strategies to improve sleep quality. Regular sleep schedules, creating a calm sleep environment, and avoiding caffeine late in the day can all contribute to better sleep. Lastly, it's important to avoid alcohol and nicotine. Both can increase pain levels and interfere with sleep. They can also interact negatively with pain medications if you're taking any. Remember, everyone is different, and what works for one person may not work for another. It's important to try different strategies and find what works best for you. It's also crucial to work with your healthcare provider to create a comprehensive pain management plan. These strategies can help reduce the intensity of chronic pain and improve your quality of life. In addition to lifestyle adjustments, certain medical approaches can also help manage chronic pain. Let's delve into some of these methods. First, there are pain relievers. These medications, often available over the counter, can provide temporary relief from minor aches and discomfort. Yet they are not a long-term solution, and overuse can lead to unwanted side effects. Then we have anti-inflammatory drugs. These help to reduce inflammation in the body, which can often be a source of chronic pain. Remember, though, that these medications also come with their own potential side effects, so it's crucial to follow the prescribed dosage. Physical therapy is another avenue. A trained physical therapist can teach you exercises to improve your flexibility, strengthen your muscles, and enhance your endurance. This method can help you move with less pain and more ease. Acupuncture, a traditional Chinese medicine technique, involves inserting thin needles into specific points on the body. This is believed to help manage pain by rebalancing your body's energy flow. While it might sound daunting, many people find it a helpful part of their pain management strategy. Biofeedback is another interesting technique. By using sensors that monitor body functions like heart rate, blood pressure, and muscle tension, it helps you to gain control over these functions. The idea is to make subtle changes in the body to achieve a more relaxed or pain-free state. Finally, surgical options exist for some types of chronic pain. These might include procedures to correct structural issues in the body or to block pain signals. However, surgery is typically a last resort when other treatments have failed. But here's the key. Before starting any new treatment, it's essential to consult with a healthcare professional. They can help guide you towards the best approach for your specific situation. Remember, medical interventions should be used in combination with lifestyle changes for optimal pain management. In conclusion, managing chronic pain requires a multifaceted approach. We've delved into the profound impact of chronic pain and the importance of understanding its nature. It's not just a physical sensation, but a complex interplay of emotions, thoughts, and behaviors too. We've explored non-medical strategies that can significantly contribute to pain management. These include lifestyle changes such as regular exercise, balanced diet, adequate sleep, and stress management through mindfulness practices like meditation and yoga. We also unraveled how medical treatments can be a crucial part of your pain management plan, from over-the-counter pain relievers to prescription medications, and from physical therapy to surgical interventions. Each has its place in combating chronic pain. Remember, there's no one-size-fits-all solution. It's about finding a balance that works for you, a harmony between your body and mind. Living with chronic pain can be challenging, but with the right strategies, you can take control and improve your quality of life.